That's right. There is a pill that can replace your insulin injections, and it's changing everything. Before we get started, let me just say this is not a sponsored video. I don't know of any sponsors for this video, but if you are interested in sponsoring my channel, please contact me at the provided email. It is a once-daily pill taken on an empty stomach that has shown similar results to Ozempic or Trulicity in terms of lowering blood sugar. Oral semaglutide also helps reduce the risk of major cardiovascular events in people with type 2 diabetes and established cardiovascular disease. This was shown in the Pioneer CV trial, which is a large cardiovascular outcomes trial that included over 6,000 participants. But is it cheap? Unfortunately, it's not cheap. A month's supply will cost you between $400 to $500 depending on the dose and your insurance coverage. However, the manufacturer does offer a patient assistance program to help cover the cost of the medication. The results showed that oral semaglutide significantly reduced the risk of major cardiovascular events, including heart attack, stroke, and cardiovascular death in participants with type 2 diabetes and established cardiovascular disease. Please like and share this video with others who might find it helpful. Don't forget to subscribe so you never miss out on future videos. Stay healthy, stay happy, and take care. However, most of the side effects are mild to moderate and tend to occur more often in people who are just starting the medication. It offers an alternative option for people who cannot or choose not to take injectable semaglutides, and it has shown similar efficacy and safety in clinical trials. As more data becomes available, we will learn more about its long-term effects and place in the treatment algorithm for type 2 diabetes. The most common side effects include nausea, vomiting, diarrhea, abdominal pain, and constipation. These side effects tend to go away after a few weeks as your body gets used to the medication. However, if they don't go away or become bothersome, you should talk to your doctor. There are also potential serious side effects associated with oral semaglutide, including pancreatitis, gallbladder problems, and kidney problems. However, these side effects are rare and the benefits of the medication usually outweigh the risks. But why take a pill when we already have injectable semaglutides like Ozempic, Trulicity, Mounjaro? Well, there are a few reasons. Oral semaglutide has been approved by the FDA for the treatment of type 2 diabetes in adults. It is available as a once-daily pill in doses of 3, 7, 14, and 30 milligrams. For one, some people simply do not want to inject themselves and would prefer a pill if it works just as well. Also, it might be easier to travel with and take a pill rather than carry around a pen or a vial and syringe. The other reason is cost. We'll talk more about that in a little bit. So without further ado, let's get into it. Now, if you are taking insulin already and have been told that you need insulin injections, this may not be for you. And we'll talk about that a little later. The new kid on the block is called oral semaglutide, brand name Rybelsus. Who can use it? Anyone who is 18 years or older with a diagnosis of type 2 diabetes and looking to lower their blood sugar levels. So does it really work? Yes, it does. Studies have shown that oral semaglutide can significantly reduce blood sugar levels in people with type 2 diabetes. In fact, studies showed similar results to those seen with Ozempic or Trulicity. One of the most important studies done so far was the Pioneer trial, which is a phase 3 trial done on over 1,700 participants. It compared oral semaglutide to placebo over a period of 26 weeks. The results showed that oral semaglutide significantly lowered the A1C levels in participants compared to the placebo group. In fact, participants taking the highest dose of oral semaglutide reduced their A1C levels by almost 1%. That's pretty impressive. And it is important to note that these results were seen in people with type 2 diabetes who were already taking metformin and either a sulfonylurea or a DPP-4 inhibitor. So it really shows the potential of this medication. It's not just about reducing A1C levels. But wait, hold on. I know what you're thinking. If it works, is it approved? Yes, it is. Okay. I see it works and it's approved. Does it have side effects? Like with any medication, there are potential side effects associated with oral semaglutide. I think it is safe to say that oral semaglutide is a game changer in the treatment of type 2 diabetes. Thank you so much for watching. I hope you enjoyed this video and learned something new.